Thank you for joining me today. In this video, you will learn therapeutic relationship. Therapeutic relationship is the relationship between the provider and the patient. It is relationship where the provider built with the patient to help them recover. So the key foundation is the therapeutic relationship is the foundation of a psychiatric care and recovery. It is healing in the mental health. It's a healing where the mental health happens through an intentional, professional relationship. And the definition is a professional, goal-directed relationship where the provider uses themselves as a therapeutically to help the patient to recover. So therapeutic relationship has a phases. Pre-oriented phase is where the provider prepare before they meet the patient. They review the chart, they review themselves, they review if they have a bias, they review the safety concerns that the patient will have. And they have a skill to evaluate themselves and to be aware of themselves. That is a pre-orientation phase. There is an introduction phase or orientation phase where you establish a trust with the patient. You will clarify the roles and expectation for the patient. You will set the goal for the treatment and for the patient. Your role as a provider is to build a rapport with the patient. You want to use open-ended questions. There is an active treatment phase or work phase. This phase is the most therapeutic work happens, where the work happens. It explore problems, emotional behavior, and implementation and intervention implementations. Most work happens in the active treatment phase. As a provider, you want to promote insight, you want to encourage the change, and you want to support the change and coping skills. There is a termination phase for the relationship. The relationship ends in this phase. Before it ends, you will evaluate the goals that you set earlier. You want to promote independency for the patient, and you want to end that relationship that you held in this session. You want to discuss the feelings about the ending of the relationship, and you want to avoid abruptly. You don't want to just quickly end the relationship. You want to, when you sit the session, you will say, we have a 1 hour or 2 hour that we are going to discuss our topic. We want to go over our discussion, and our discussion will be based on it will be the medication. We are going to go over the medication. We are going to go over the outpatient treatment. We are going to go over the follow-up appointment. We are going to go over your house, your safety, what to do next, and this will be 1 hour. This session will end after hour, but if you want to contact with me or if you want to follow up with me, I will set the appointment that day. Also, you have my email and my phone number. Hopefully you have your work phone and your work email. And that is how you're going to end the session after you go through all the phases and all the goals and all the evaluations and all the discussions with the patient. You don't want to just go and say, hi, bye. You don't want to do that. You want it, even when the session ends, you want to set follow up or who they follow up with. If you have somebody else that they're going to follow up in outpatient, let's say you work in hospital setting, you want them to connect with outpatient provider, and you want to give that email or phone that they can connect with. Also, you want to show them that you are open. If you want to come back to the hospital or if you want to have a question, you can call that phone number. Somebody will be there for that phone number to answer your questions. That's how you're going to end the session. There is a therapeutic communication and it's an essential skill as a provider that the therapeutic communication is to build trust, to encourage expectation, and to gather data. You want to communicate with them therapeutically to build a trust with the patient, to encourage them to express their feeling, their doubts, their goals, their emotion, and you want to listen and be there for them. And then you want to gather data. What are their concerns? What are their goals? What do they need help with? What are they going through? So that is what you want to do that. And therapeutic technique is a useful. And therapeutic techniques include open-ended questions, reflection that you are reflecting on their thoughts or their opinion, what they told you, that you hear them, what they say, and you want to reflect on that. You want to have a silence and you want to listen to them, and you don't have to agree everything, but you will listen to them and you will say, I hear you say that. This is what you can do. This is how you can prevent that. This is how you can improve that. You guide them. There is a validation if what they telling you or what they are communicating, if that is the correct, you will validate them. And then you will summarize what they tell you. You will summarize and go over and say, I hear you say this. Isn't that correct? And then that's how you summarize what they already mentioned to you. For example, you want to tell me more about you, how you are feeling. That's how you begin the open questions. You want to avoid giving advice when they are talking. You want to avoid false reassurance. You don't want to give them false reassurance. You don't want to ask them why. Why do you think that way? Why is that happen? Why you want to avoid whys. Changing the subject. You don't want to change in the subject. You want to listen to them first and listen and understand where they are coming from. You want to avoid judgmental response. For example, you want to avoid, you shouldn't feel that way. You can't say that. You are not in their body. You are not in their shoes. You are not this person. You can't say you shouldn't be feeling that way. This is not you. This is themselves. This is how they feel. You are just there to help with them. You are not there to talk for them. They can talk that for themselves. So you want to avoid that. You want to use of self. Use of self. Using your personal value and perception as a therapeutic tool. Include empathy, include genuineness, include self-awareness, include boundary. You want to use those as a tool. Empathy, you want to show understanding the patient feeling, understanding them, sympathy, feeling sorry. You are not going to say sorry, but you feel that way. You will be therapeutic. Family dynamic in a care. Mental health affected the whole family, as we mentioned before. So as a provider, you want to assist the family interaction. You want to provide psychoeducation. You want to support the healing and communication. Common issue include a caregiver burnout, family get tired, family get impatient, family then that can lead to conflict, inability to behave. It will affect them, their emotion, their control. So you want to provide that therapeutic education. You want to help with them to see the light in the tunnel, if there is a light in the tunnel. You want to support the individual. So peer support. Peer support is a support from individual with lived experience of a mental health. So the peer support is somebody who already recovered from mental health, who've been through this experience and they recover, and they will be peer support to this patient who is going through where they were before. The benefit of that is it will reduce the stigma, it will build hope that they can do themselves too, it will improve the engagement. So the peer support reduce stigma, build a hope that they can also do it, improve engagement because they most likely trusted this person who already been through and been their shoes before. Example of a peer review will be group support, recovery, mentor, peer counseling. Patient engagement. The patient actively participate in the care. How the provider improve patient engagement. Respected their independence. Build trust with the patient. Use a motivational intervention. Address the barriers. You want to address the barriers like transportation, stigma, cost, financial. Poor engagement include not adhesive to the medication or the treatment, relapse. If they relapse, that is it leads to relapse. It leads to non-adhesive to the treatment or the medication. The outcome will be poor. So you want to encourage engagement. You want to help them to engage. Trauma-informed care. Trauma-informed care is an approach that recognizes impact of a trauma on a mental health. Trauma can affect the mental health. The core principles include the safety, trustworthiness, choice, collaboration, and empowerment. The mindset is what happened to you, not what is wrong with you. You want to say what happened to you, not what wrong with you. The provider role is to avoid re-traumatization. You want to avoid use gentle communication. You want to provide a controlled and safe environment, but you want to avoid re-traumatization and judgment. Boundary. There is a type of boundary. The therapeutic boundary is the correct one. Professional, goal-focused relationship. Friendship not appropriate in a clinician and clinical care. Patient is not your friend, it's your patient. So it has to be professional and goal-focused only. Initiating a personal, so you don't want to share personal information. You don't want to accept gifts. You want to have any other relation than that therapeutic relationship. Defensive mechanism and transference. Defensive mechanism. Patient protected their feeling. Transference, that is what it is. Transference is when the patient projected their feeling on the provider. Countertransference is when the provider projected their feeling on the client. So those both are wrong. Must be recognized to maintain the therapeutic relationship. You want to avoid that and you want to recognize it. And that is not therapeutic relationship, that the transference is not what you want to have. Role of the provider is to build trust, to maintain a boundary, to promote communication, to support emotional expression, to encourage independence. So as a provider, your role is to build a trust with the patient, to maintain a therapeutic boundary, to promote communication. You wanted them to express their feeling and doubts and concerns and goals. You want to promote emotional expression. You wanted them to express their emotion. You want to encourage them to be independent and do what they can do safely. So there is 4 phases of a therapeutic relationship. There is a therapeutic and non-therapeutic communication. Boundary, there is a boundary between the provider and the patient. There is empathy and sympathy. Trauma-informed care. Transference versus the transference and countertransference. So the 4 phases of the therapeutic relationship are the pre-orientation, orientation, work, and termination. So pre-orientation phase, orientation phase, working phase, and termination phase. Therapeutic relationship in a psychiatric uses communication, boundary, trust to promote patient recovery and treatment and emotional healing. Thank you for joining me today. I would love to see you in my next video. Thank you.